Most people with diabetes are the ones which are obese or the one who are rich. But that is false, it's not true.
Hi, my name is Mehjabeen Esmail. I'm a pharmaceutical personnel practicing in the healthcare field, and today I'm here with Dr.
My name is Dr. Mlawa. I'm practicing cardiology.
So today we're here to raise awareness on diabetes. As we all know, November is Diabetes Awareness Month. So our doctor here, expertise, who deals with patients who are hypertensive, diabetic, he will give us more overview on the experiences that he's had on diabetes.
Yeah, we try answering few questions about the diabetic and the cardiovascular disease because they are interlinked with these diseases. So we can answer a few questions about these diseases.
Okay, so maybe what people would like to know is what are the key risk factors that link diabetes and cardiovascular diseases, and how does early screening help to mitigate these risks?
Yeah, the key factor risk which link the cardiovascular disease, this obesity, hypertension, and also dyslipidemia, and also conditions like people who don't practice, who don't do exercise, people who drink alcohol or who smoke. There's a strong link between diabetes and the cardiovascular diseases. So early screening of these diseases, when you start early the treatment, it will mitigate the complication that may occur.
Okay, so what role does early detection of diabetes play in preventing or managing the heart-related complications?
Yeah, there's a very big role in preventing these diseases, which in managing heart-related cardiovascular diseases. As we know, if someone has got diabetes for a long time, it usually causes damage the nerves and the arteries. So once you damage it, they cause the cardiovascular conditions. So when we detect diabetes earlier, we prevent the complications, and when we treat and we do the lifestyle, for example, if we eat healthy food, we do regular exercise, and if we stop cigarettes and reduce alcohol.
Okay. And so what are like some of the complications a patient might face, like some of the heart-related complications due to diabetes, maybe damages, what kind of nerves does it damage?
Yeah, usually the commonest complication with diabetes, usually this we call microvascular nerve, these vessels. Usually the nerves of the vessel of the eyes, the vessel of the kidneys, of the eyes. So usually they can get diabetic retinopathy, or they can get other condition related to diabetes.
Okay. Could you provide maybe some data or statistics that highlights the prevalence of diabetes in patients with cardiovascular related complications, and how does this impact their overall health?
Yeah, globally, 32% of patients with diabetic they suffer from cardiovascular diseases, and the commonest conditions are the coronary heart diseases or with strokes. So, and these conditions are the one causing high mortality to those patients with type 2 diabetes.
Okay. So how often, let's say if a person is not diabetic, how often should they go for a screening, or for patients who are diabetic?
Yeah, usually, if you are about 45 years of age, usually we advise you to start screening. And if we find, for example, if you are negative, you don't have diabetes, we can advise you to come after every 3 years. But if a patient, suppose they've got these risk factors like hypertension with diabetes or hyperlipidemia and others, usually we say we should come to frequently for checkup. And once we you diagnose the disease, we start treatment immediately. And those who don't have the disease, we can wait for 3 years.
3 years.
Yes.
So that is like any age.
Yes. But usually 45 years is the one, usually when they have these the risk factors usually. But others, you can stay for 3 years, is what you can screen.
Okay, so what advice would you like to have for people who are hesitant to come for these screenings? How would these screenings help their overall heart health, these diabetic screenings?
Now, for me, I would tell them it's very important to screen for diabetes, because once we diagnose that you have diabetes, we can start immediately for the treatment. And once we treat earlier, you can reverse and the complication of the complication related to diabetes.
Yes. So from your experience, Dr. Mlawa, like you've been dealing with different variety of patients, different populations. What are some of the most common misconceptions or myths amongst people that you would like to debunk regarding diabetes and cardiovascular diseases?
The most common misconception people have, they say if someone is diabetic, most people who have diabetes are the ones which are obese or the one who are rich. But that is false, it's not true. It may be possible, most of they see people with the diabetic who are rich and the obese, but diabetes, you can get any age, whether you are obese or not, whether you are rich or poor. That's the misconception people have.
Okay, thank you so much. It was really nice to have you, Dr. Mlawa.
Thank you very much.